morning everyone. My name is Palak Valecha. I'm a student of B Farm second year, KIET group of institutions. Member of Aayushmaan and Pharma Innovation Club of KIET School of Pharmacy. Today, on the occasion of Sickle Cell Anemia Day, I would like to give a short introduction about sickle cell anemia. The body produces normal red blood cells that are flexible and round and can easily move through the blood vessels. In sickle cell anemia, red blood cells become rigid and sticky and form like a sickle or crescent moon. These irregular shaped cells can get stuck in small blood vessels, which can slow or inhibit the flow of blood or oxygen to parts of the body. Red blood cells live for 120 days before the body needs to be replaced. But sickle cells usually die within 10 to 20 days, causing a red blood cell deficiency that leads to anemia. Sickle cell anemia is a hereditary type that is transmitted by genes from parents to their children. That is, it is non-contagious and cannot be picked up by a person like cold or infection to other. Thank you.
Good morning. My name is Shyamlal. I'm a student of B Pharma second year, KIET group of institutions. I'm a member of Aayushmaan and Pharma Innovation Club, KIET School of Pharmacy. Today I'm going to tell you about the symptoms of sickle cell anemia. The symptoms of sickle cell anemia are pale skin, fatigue and exhaustion, vision problems, severe pain, delayed growth, chronic pain episodes, and repetitive bacterial infections.
Good morning, my name is Rajendra Singh. I am a student of B Pharma second year, KIET group of institution, member of Aayushmaan and Pharma Innovation Club of KIET School of Pharmacy. Now, further I would like to tell you about causes of sickle cell anemia. It is a genetic disorder caused by mutation in the hemoglobin gene. This gene provides instruction for the body to produce a part of hemoglobin. A mutation in the hemoglobin gene causes hemoglobin to clump together and changes in the shape of RBC. This leads to anemia and blocked blood flow for the people with sickle cell disease.
Hello everyone, this is Harsh Srivastava, a student of B Farm second year at KIET Group of Institutions, Ghaziabad, and I am a member of Aayushmaan and Pharma Innovation Club at KIET School of Pharmacy. Ready. And I am here to brief you about the diagnosis of sickle cell disease. It starts with a simple blood test, often is all that is needed for the healthcare providers to make a diagnosis of sickle cell disease, that is abbreviated as sickle cell disease (SCD), a group of inherited conditions in which red blood cells, that is RBC, acquire an abnormal sickle-like shape and die prematurely. The disorder often results in anemia and circulatory problems, and people with sickle cell disease can pass it on to their biological children. Generally, all the individuals have two copies of the given gene, one inherited from each of the parent. People who inherit only one mutated copy of the HBB gene usually do not show any symptoms of sickle cell disease when are said to have a sickle cell trait. However, those who have two faulty copies of the genes will develop a sickle cell disease. Several screening tests can be performed to identify the presence of sickle cell disease. Screening of SCD is done with a simple blood test that detects the presence of abnormal hemoglobin proteins.
My name is Shashank Prakash. I am student of B Farm second year, KIET group of institutions, member of Aayushmaan and Pharma Innovation Club of KIET School of Pharmacy. Here I am going to explain about risk factors of sickle cell anemia. In the United States, most people who have sickle cell disease are of American ancestry or identifying themselves as black. About 1 in 13 black or African American babies is born with sickle cell trait. About 1 in every 365 black or African American babies is born with sickle cell disease. There are also many people who have sickle cell disease who came from Hispanic, Southern European, Middle Eastern or Asian Indian background. About 1 lakh Americans have sickle cell disease. Thank you.
My name is Kavita Katyar. I am a student of B Farm second year from KIET group of institution, member of Aayushmaan and Pharma Innovation Club. Today, my topic is transmission of sickle cell anemia. Sickle cell is a lifelong health condition. It cannot be transmitted to other person just through the physical contact. A person can only get infected if both of their parents are infected with the same. A child has to inherit a copy of sickle cell gene from both parents. That means either they have to be infected or they have to be the carrier. When both the parents are carrier, there is a chance of 1 in 4 that a child will not get inherited.
My name is Anmol Vats. I am student of B Farm second year, KIET group of institution, member of Aayushmaan and Pharma Innovational Club of KIET School of Pharmacy. My topic is various complications of sickle cell anemia. So various complications that may occur due to sickle cell anemia is ACH, acute chest syndrome. In this person can suffer from chest pain, difficulty in breathing and fever, coughing, etc. Secondly, avascular necrosis, AVN. So sickle cell can block blood flow in the blood vessels that provide blood to bones in our body. When bones doesn't get enough oxygen, the avascular necrosis may occur. Symptoms are not found, but it can result in mild or serious joint pain. It can also lead to many more complications such as kidney problems, leg ulcers, infections, damage in organs and many more.